Hi my dear student, I am Muhammad Hassan, student of Master Degree for Nursing Pediatric in University of Shahid Beheshti Medical Science, and my supervisor Dr. Lidanek Farid. And in this video I will explain what are the intestinal obstruction in children. So, I will explain what are the intestinal obstruction in children and what are the signs and symptoms, what are the causes, and how can I diagnose it, and what are the treatment, and finally what are the complications. Obstruction in children are one of the diseases that mothers suffering from it, as it causes severe pain to the child, which leads to crying and screaming. An intestinal obstruction is a mechanical or functional obstruction of the intestines, which prevents the normal movement of the products of digestion and prevent food and liquid and gas from moving. So, after we take knowledge about the intestinal obstruction in children, now I will explain what are the signs and symptoms. And the first, abdominal pain. Abdominal pain is the most common symptom in obstruction due to abdominal cramps that is prolonged or intermittent on contraction that stop of minute and return again. Another one, a swelling in the child abdomen. Another one, vomiting. Attention must be paid for the color. As the child begins to vomit the food that he eats, then it turns yellow and finally green, which means emergency help, and also timing of vomiting immediately after food or at a certain time. Another one, loss of appetite. Another one, constipation. It is a mainly common disease in children, where intestinal obstruction is not the causes. And another one, an inability to have a bowel movement or pass gas. And maybe the child may have fever or appearing excessively drowsy. So, after finish the sign and symptom of intestinal obstruction in children, if anyone notices this symptom or other change in child, seek immediately medical attention. After finish the sign and symptom of the intestinal obstruction, now I will explain the causes. The causes here have two types, either congenital birth defect or non-congenital. So, in the congenital birth defect, that will be in the after-birth fetal or the neonatal bowel obstruction are often caused by intestinal atresia, where there is narrowing or absence of the part of the intestine. And a non-congenital birth defect, either mechanical obstruction or non-mechanical obstruction. I will explain the mechanical obstruction. So, when something physically blocks the small intestine and also blocks the colon or large intestine. So, in the beginning blocks the small intestine due to or causes by adhesion are bones or scar-like tissue. Normally, internal tissue and organs have slippery surface, so they can shift easily as the body moves. Adhesion causes tissue and organs to stick together. They may connect the lobes of the intestines to each other, non-nerve organs, or to the wall of the abdomen, and also fibrous tissue that develop after abdominal surgery. That will be occur when twisting of the intestine. Another cause is intussusception. It is the most common in the children. And as you see in the picture, it is a condition in which one segment of the intestine telescopes inside of another causes on intestinal obstruction, blockage. And intussusception can occur anywhere in the gastrointestinal tract. It usually occurs at the junction of the small and large intestine. The other one, tumor within the small intestine. and also gallstones. Maybe can, but rarely cause obstruction. And another one, celoid objective, and also hernia. Hernia is a portion of the intestine that protrudes outside of the body or into another part of the body. Another one, Crohn's disease, is an inflammation bowel disease. It causes inflammation of digestive tract, which can lead to abdominal pain, severe diarrhea, fatigue, weight loss, and malnutrition. Inflammation caused by Crohn's disease can involve a different area of the digestive tract. So, after the knowledge about blocks of the small intestine, now mechanical obstruction can also block the colon or large intestine. This can be due to colon cancer and meconium plaque in newborn, and also diverticulitis is the inflammation or infection of blocked portions of intestine. The last one that maybe causes blocks or narrowing in the mechanical obstruction. The structure is a narrowing in the colon caused by scarring or inflammation. Now I will explain non-mechanical obstruction. Any delays in transit or obstruction can occur when the muscle or nerves with either the small or large intestine function poorly. This process is called paralytic ileus if it is an acute or self-limited condition, and it is known intestinal pseudo-obstruction if become chronic. The intestines normally work in coordinated system of movement. If something interrupts these coordinate contractions, so it can cause a functional intestinal obstruction. This paralytic ileus as clearing in the picture. Now I will explain the causes of paralytic ileus. In the beginning, abdominal or pelvis surgery and infection. Infections such as gastroenteritis or appendicitis. Also some medication such as opioid pain medication and decreased potassium level and mineral and electrolyte imbalance. That may be causes paralytic ileus. Second causes of non-mechanical obstruction are intestinal pseudo-obstruction. Is a clinical syndrome caused by severe impairment in the ability of the intestine to push food. So, it is characterized by the sign and symptom of intestinal obstruction without any lesion and any lumen, and caused by Parkinson's disease and Hirschsprung's disease. Is a congenital disorder of the colon in which certain nerve cells, known as ganglion cells, are present causes chronic constipation. The lack of the ganglion cell in the mesenteric plexus, which is responsible for moving food in the intestine. And also neuromuscular disorder and diabetic mellitus or other disorder that causes neuropathy. Also there was another causes but less common, such as impacted stool that maybe blocks the colon or large intestine. Now I'll explain about diagnosis or how can we make diagnosis. After knowledge, as I explained in the beginning of the video about sign and symptom. Now the test and procedure that used to diagnose intestinal obstruction include physical examination. Ask about medical history and symptom. Also conduct physical examination to assess his or her condition. Also suspect an intestinal obstruction if his or her abdominal is swelling or painful, or there is a lump in the abdomen. And listen to the intestinal sound by using stethoscope. We can diagnose by use X-ray. To confirm a diagnosis of intestinal obstruction, recommend an abdominal X-ray. As I'll see in the video, the dark area means the area of blocks. However, there are some type of intestinal obstruction that cannot be seen with X-ray. So we can diagnose by use computerized tomography CT scan. A CT scan combines X-ray image taken from many angles to produce a cross-sectional image. As the all see in the video, the area that's narrow or blocked. These images are more detailed than a conventional X-ray and more likely to show intestinal obstruction. We can diagnose this by use ultrasound. It's often the preferred type for imaging to use. An infant with the intussusception and ultrasound will usually show the bull's eye, which represents the intestine wrapped inside the intestine. Fetal and neonatal with atresia are often discovered before birth via an ultrasound. So we can diagnose by use air or barium enema. Basically, an air or barium enema is an improved colon imaging procedure that can be performed to discover suspected cause of obstruction. During the procedure, introduce air or liquid barium into the colon through the rectum. Forced into susception in children. An air or barium enema can most of the time fix the problem and no further treatment is needed. And we can diagnose by use blood test for blood count, liver and kidney function, and level of electrolyte. And finally, colonoscopy. Colonoscopy is a flexible lighted tube that used to look at the large intestine. To complete the diagnosis now, I will explain the treatment. We always advise parents to see a doctor when they notice any symptom or swelling in the child because early detection of the problem helps to treat it. Treatment depends on the location and severity of the obstruction. Don't attempt to treat the problem at home. The appropriate treatment depends on the type of intestinal obstruction. After making the diagnosis through X-ray and other tests, we insert a tube from the nose into the stomach and intestine to relieve pressure, swelling, vomiting. Then give intravenous nutrition in addition to antibiotic. Treating dehydration is important. A doctor maybe give IV fluid to correct electrolyte imbalance. A catheter may be inserted into the bladder to drain urine. For partial obstruction or an ileus, it may be possible to treat by simple resting the bowel and giving intravenous fluid. Bowel rest means you will be given nothing to eat or clear liquid only during that time. Also, we can treat by give some medication. Medication cannot treat the obstruction itself. They can help reduce the nausea until further intravenous are performed. Example for medication, such as antibiotics to reduce infection, anti-nausea medication to keep from vomiting, or pain relief, and also treatment for inguinal hernia because there is relationship between the inguinal hernia that afflicts many children as a common problem, which sometimes causes intestinal obstruction. So we always strive to treat this type of hernia area. If these measures fail or if the symptom become worse, treatment in this case typically require hospital stay. Surgery will be required. Will be given IV fluid because in addition to relieving dehydration, they help to prevent shock during surgery. Surgery is almost always needed when the intestine is completely blocked or when the blood supply is cut off. The diseased part of the intestine is removed and the remaining part is sewn to the opening in the skin. Stool passes out of the body through the opening and collects the disposable bag. Fetal and neonatal treated with using laparotomy after birth. If the area affected is small, then the surgeon may be able to remove the damaged portion and join the intestine back together. In intestine where the narrowing is longer or the area is damaged and cannot be used for the period of the time, temporary stoma may be placed. also maybe can use liquid or air enemas or a small mesh tube metal stent to open up the blockage. Finally, I will explain the complication. The neglect lead to complications such as swelling and damage to the intestine, and sometimes perforation in it, which leads to a serious deterioration of the health condition. Germs may be exit the intestine into the abdominal cavity, and from there they may be enter the blood and causes serious problem to the child. And also the another complication, dehydration. And also electrolyte imbalance, infection, kidney failure maybe. And if the obstruction is preventing blood from getting to a segment of intestine, this can lead to infection, tissue death, intestinal perforation, sepsis, a life-threatening blood infection, multiple organ failure, and death.